Hospitalists are physicians who specialize in caring for patients while they're in the hospital. They work closely with primary care physicians.
A hospitalist is basically the physician that will take care of a patient that gets admitted to the hospital setting. It's a concept that people are trying to learn because they're used to seeing their doctor in the hospital, and now you're seeing an unfamiliar face who is expected to take care of you when you're at your sickest. So we're there to help step in and take care of patients when they're really at their sickest and their medical condition is probably the most complex it's been in some time. I think that it's a relatively new concept. I know when emergency room physicians first started out, it was kind of a foreign concept, but they've become specialists in the emergency setting, and hospitals are kind of the same, and more and more patients are going to get admitted to the hospital. Things are going to get more complex, and it would be nice to have somebody who really can handle that amount of information, the new treatments, etc., but also give a good handoff to their primary care physician when they get out of the hospital.
What type of training do hospitalists receive?
So after medical school, a lot of us and our colleagues go our different ways, and internal medicine residency is generally what most people go through. Some people are family medicine trained. After they do their residency program, which is generally about 3 years, then you start working. And so during that 3 years of time, you are exposed to hundreds and hundreds of different medical problems on a daily basis, on a yearly basis, and that gets you familiar with what you're going to see in the hospital. There's several conditions which are more common than others, and so you refine your treatment of those. But at the same time, when you see those rare conditions or patients that are just a mystery, in the hospital setting is where we can really try to come to that diagnosis and, more important, some sort of effective treatment.
What are the advantages of having hospitalists available?
Medicine's gotten much more complex over the years. My dad was a practicing physician for about 30 years or so, a pediatrician, and so he would see his own patients in the hospital. I tried to explain my job to him, and he had no understanding of what I was talking about. Why doesn't the regular doctor see him? But he's come to realize that medicine's gotten so much more complex, so many more medications, and so many more ways to treat things that you really need a specialist in the hospital, and that's basically what we are. We're specialists in the hospital.
And how are primary care physicians included in treatment plans?
The electronic medical record has made that a little easier when somebody's on your same network, and we can pass information back and forth. But if there's a patient who we just need to bridge that gap of, well, what's been going on with them the last several weeks, we can reach out to their primary care physician, and I'll tell you the vast majority of them, if not all of them, are very thankful for that. And when a patient hears, hey, I talked to your doctor, that really gives them a sense of reassurance that, okay, good, somebody's trying to bridge the gap and really communicate with the person that's going to see me outside of the hospital.